Brandy H is a 35-year-old female presenting to the clinic with complaints of feeling unsteady when she walks. She also reports experiencing unusual sensations in her lower extremities, describing it as if her pants have static cling. She has a history of migraine headaches, which typically respond well to ibuprofen. Brandy has been experiencing these new symptoms for about 1 week. Hello, Brandy. My name is Patricia Sosa, and I'm a family nurse practitioner student. It's nice to meet you, and thank you for coming in today. I'll be taking care of you during your visit, and I'd like to ask you a few questions to better understand how you're feeling. Please feel free to speak openly. I'm here to help.
Hi, Patricia. Thank you. I appreciate that.
Let's start with what brought you in today. Can you tell me more about the symptoms you're having?
Sure, I've been feeling unsteady when I walk, like I might lose my balance. It started about a week ago. Nothing specific seems to trigger it, but it feels more noticeable when I've been walking for a while or standing up for too long.
Can you describe the feeling in your legs? Is it more like tingling, numbness, coldness, or weakness?
It's like numbness, and sometimes it gets itchy, almost like my pants have static cling. It's a weird tingling, buzzing kind of sensation.
And is that constant, or does it come and go?
It's mostly constant, but I notice it more when I'm walking or standing for a while.
On a scale from 0 to 10, with 0 being no symptoms at all and 10 being the most intense, how would you rate how uncomfortable or severe the feeling is?
Probably a 6. It's not painful, but it's uncomfortable and distracting.
And you mentioned this started about a week ago. Did it begin suddenly, or did it come on gradually?
It's mostly constant, but I notice it more when I'm walking or standing for a while.
Does that sensation travel or spread to any other part of your body?
No, it stays in my legs. I haven't noticed it anywhere else.
Have you had any problems with your vision, like blurriness, double vision, or eye movements that feel off?
A few days ago, my right eye got a little blurry. It only lasted a few hours, so I thought it was related to my migraine.
Any eye twitching or jumping movements?
Sometimes when I'm tired, my eyes don't focus right and feel jittery.
Any stiffness or muscle tightness in your legs?
Yes, my calves feel tight, almost crampy at times.
What about walking or balance?
I feel off, not dizzy, just like I have to be careful or I might stumble.
Any issues with hand coordination or tremors?
I've noticed a slight shaking when I try to do something precise, like putting on earrings.
Have you experienced urinary urgency, accidents, or constipation?
Yes.
How's your sleep?
Restless. I wake up often and my legs feel uncomfortable, like they need to move.
Have you had any nerve-type pain, like burning or stabbing?
Sometimes in my lower back and thighs. It's random but sharp.
And you also have a history of migraines, correct?
Yes, I usually get migraines every now and then, but they respond pretty well to ibuprofen.
Have you had any recent migraines since these symptoms started?
I had one a few days ago, but it wasn't any worse than usual.
Has anyone in your family ever been diagnosed with a neurological condition? Things like multiple sclerosis, Parkinson's disease, epilepsy, or stroke?
Not that I know of. My mum has migraines like me, and my grandmother had a stroke in her 80s, but nothing like MS, as far as I know.
Brandy, we'll do a thorough neurological exam and may order some imaging and labs to help us understand what's going on. Thanks for sharing all of that, Brandy. Your symptoms, particularly the sensory changes, vision issues, fatigue, and imbalance, raise the possibility of a neurological condition like multiple sclerosis. I'd like to order an MRI of your brain and spine and possibly refer you to neurology for a full workup. We'll also do some labs to rule out other causes like vitamin deficiencies or autoimmune conditions.
That sounds good. I've been feeling like something's not right, and I appreciate you taking this seriously.